Clark is the Marketing and Communication Specialist with Titusville Area Hospital. She joins us this morning with special guest, Dr. Dwain Rogers. Good morning. Good to see you this morning.
Good morning. Good to see you, Luke.
Kelly, it's been a busy few weeks at the hospital. A lot going on.
It has been a busy few weeks. July has been busy. So thanks for having us on. Yes, I'd like to welcome Dr. Dwain Rogers. He's our one of our general surgeons at Titusville Area Hospital.
Yeah, good morning. Welcome.
Thank you.
Good to see you. Before we get into what you do at the hospital, Kelly mentioned general surgery, but tell us a little bit about yourself. Where'd you grow up?
I am born in the Caribbean, little island called St. Kitts. Used to be called St. Christopher after Columbus,
Wow.
but it became independent and changed its name. I've been in the United States since I was 17, and I've been with Titusville since November of 2012.
At what stage in life did you say, this is what I wanted to do?
I was at large hospitals in large cities for a very long time. Got tired of the impersonal nature, numbers, names. I really prefer small town medicine, the ability to bring big town medicine to small towns so patients don't have to be transported to bigger hospitals. We do sometimes have to do that based on capabilities and need, but in general we can handle most issues in town.
Were you young, in your teens, when you decided like this is the path you wanted to take getting into medicine?
I was 11.
11.
Yes.
Was there a moment or something, or you just said, this is what I want to do?
There was a moment.
Okay. That's great.
When I knew what I was going to be doing.
And it hasn't changed?
It was cardiothoracic surgery, but at a point during that fellowship, I got tired of doing the same operation every day.
Yeah.
I went back to general surgery, trauma, critical care, bariatrics, and now I'm here.
So really, every day's sort of different for you, isn't it? In terms of the patients that you see.
Yes. It's sort of the experience of not knowing what's going to come in the door and having to be ready for whatever does.
For with what you do you have to have like that sense of like that private investigator type of mentality, trying to solve the puzzle?
I think of it more as treating a patient as if they're you, and what would you want done? And what you would want done is someone that's going to listen, pay attention, show respect, but know what they're doing. And when I was day one in residency, that is 35 years ago, a couple months ago, 35 years ago on May 14, the chairman of surgery said something to the entire group coming in that made no sense then, but perfect sense now. He said, we can teach anyone to operate. A surgeon knows when not to. Judgment, clinical judgment, critical judgment, patient safety. That is something that always stays in the back of my head. Do no harm. We're not perfect. We're people, just like the patients. We get sick like them. We make mistakes like them. But if you aim for perfect each time, you're going to get it most of the times. And I think that's what patients deserve. So you must care, first of all. And if you care, everything else follows. And if you see patients as people, everything follows.
It's got to be interesting to see what has stayed the same over that time, and then what has changed with technology. Is it getting to the point where there's less and less of that fundamental, because it is changing so much, or is there still a solid base there?
It's an issue. I have students. I've been carrying students for decades. Medical students, residents, physician assistant students, sometimes a myriad of them. The thing I have seen, unfortunately, is the education is very general, but not very specific. So it's sort of teaching a mechanic who wants to work on cars every kind of engine there is, knowing they're just going to work on cars. It fills their head with a lot of information about a lot of things, but not the information they need. And that's where the training comes in, not the didactic in classroom, but the clinical. And fortunately, that is where I come in with the students, and I can sort of take that clay mold and shape it based on what they want to do. That has become better. When I was in training, everyone was chiseled into the same shape. Then they let you go and you had to find your form. Today, that has improved. If that could be streamlined in the didactic area, classroom, that would be even better. But it takes time for education to change, but
Yeah.
it is improving.
You mentioned you wanted to get to a place where patients weren't just a number, but you got to know them personally, maybe their families. What's that like to you when you're just out in the community and somebody has a big smile on their face and says, "Hi, doc, thank you, and how are you?" And there's a relationship there.
It's interesting. People refer to me as doctor. I don't refer to me as that. I refer to me as Dwain. I'm a person. People can ask me anything, anytime. If I have the answer, I'll give it to you. If I don't, I'll look it up, find out, and I'll get the information to you. I think when you look at a doctor as different to you, that creates a gap. You don't want that kind of a gap with someone that has your life in your hand. You want a relationship. And that's the reason I left Big Town Hospital, the reason I left 600-bed hospitals. That is the reason I'm in this small town. Patients get to know me, I get to know them, and they understand they can call me at any time. They can call the hospital, ask for me, I will sit down and talk to them. I'm never unavailable. They're never less important than anything else to me. That is what I've aimed for. I've gotten it here. So I'm really lucky with that.
Yeah, and it seems like the hospital's really good at investing back into itself
Yes.
with equipment and things that you need. Do you find that you can go to them and say, "Hey, can we get this or upgrade this?"
In general, yes. I'm the chair of the Department of Surgery. So while it is nice to say I'd like this, I do have to consider the practical reality of, is it going to be done better here if we do it, or where people have been doing it for decades? So yes, I can go to administration and request equipment, but I need to make sense to them of why we need that equipment, not just I want it.
Yeah.
And having a lot of kids has allowed me to learn how no means no and why. So we have a relationship with administration. We present them a practical plan of how this is going to improve care. They work the finance, and then they give us a yes or no. And usually, over 80% of the times, it is a yes. But we don't make frivolous requests.
Yeah. That's where the magic of Kelly and Holly come into place, and they'll get it done.
Yeah.
What's the approach to your day? How do you start your day?
I have one mission every day. I need to save a life every day. One. If I do more than that, great. But if I don't, that's a bad day for me. I need to make a difference. And not just me. I represent the hospital and the community. In and out of the hospital, 24/7. Everything I do, everything about me represents the hospital. That type of motivation allows me to get up and do what I do, but I also have to maintain standards of care. It can be a little difficult sometimes because you want to help, but you know they're better served elsewhere. And you have to make that hard call, you must transfer. That is tough. Sometimes the patients want to stay here. They know me, they want to stay here. It's not in their best interest. While technically I can do anything at Titusville Hospital cannot do everything. It's limited. And so that's hard. But over the time, I've gotten used to being able to make those clear clinical judgment calls and being able to defend it. When, why not? We actually can't do this here. It's not safe. And I can present the data. Administration provides us with access to the most current medical standards of care data at no cost to us. So there really is no excuse to be able to say, this is safe, that is not, and have the data. But that is the objective, to save a life every day. And I've been pretty good at it. Well over 90% of the time, I've made a positive influence. I don't get it right all the time. I never claim to be a god. I'm not. I'm human. But I try to improve each day.
And you mentioned the community aspect. It is nice when you are at an event and you're over there cheering somebody on. And
yeah, everyone knows me. Everyone knows me. It is very nice, but I don't let it go to my head.
Yeah.
I have a large slice of humble pie every day.
And that's great. That's great. You're watching the Morning Drill on Stream TV and on the Armstrong Neighborhood Channel. Friends at Titusville Area Hospital with us here this morning. Kelly Clark and Dr. Dwain Rogers with us. Kelly, you mentioned a busy couple weeks.
We have.
What's been going on?
Recently just finished our history wall unveiling. We did that in honor of our 125th year at Titusville Area Hospital. It was a nice event and a nice unveiling. If you were in the hospital and would like to view it, come in and walk down the main hallway past the elevators and take a look at it. A lot of work went into that. So it's something special that we added to commemorate our anniversary this year. So thank you to everyone that came to the event.
Like 125 years worth of work went into this, right?
Right, yeah, right. So yes, thank you everyone that came to the event, and it was very nice to, like I said, commemorate those years that we have been in Titusville.
That's great.
Yeah, we've had...
On to the next 125, right?
That's right. We also recently just finished an improvement. The ICU got a facelift. The last renovation it had was 30 years ago, I believe. There's a picture right there of the last renovation. So it was definitely due. So it got...
Looks like something from Doogie Howser.
Right? Got that salmon color there.
Yeah, that's very nice.
So we gave that a facelift, all new flooring, all new fixtures. Really looks really great. Just to better care for patients, comfort, and care in one of the vital units of our hospital. So we were happy to have a 3-week turnaround in that unit. So thank you to our maintenance team, had a really big hand in that and helping our contractors get that done. And it was a good project. So thank you to everyone that contributed to it. I wrote some grants, and we also had a lot of community support for that.
Nice. What'd you do with the salmon desk? I hope you kept it in storage for...
Yeah, right? It'll be the next 100-year event, right? 200-year event.
Yeah. Unless it's... Is it your house, Doc? Maybe you have it as a kitchen island?
No, I think we're happy to see that leave.
Okay.
Wow, we have another event coming up, Crawford Gives. I know they've been doing a good job of publicizing that. That's coming up August 12th through the 15th. That will, those funds raised will go towards our next project, which is the therapy expansion project. We've talked about in the past, that's what our golf scramble was raising funds for. So we had a slight change in our plan, which is a good change. We recently acquired the old Rite Aid building, and so the therapy expansion will take place in that building.
Wow.
Yes, and the old physical therapy building, when we move PT over, will become the regional training center for our new dental clinic.
Oh, that's fantastic.
So we'll be able to house all of those things a little bit easier with the addition of the Rite Aid building. So that was something new that has just come about. So the project is still on. It's just changed the space for a couple of feet, actually. So,
That's great.
yeah. So we're
and
excited.
When will that project get underway?
So that project is already underway. We have a deadline to open our dental clinic by this time next year. So July of 26, we will be opening that training dental clinic. So those projects are really going to be moving quickly. So.
And that's in partnership with the Education and Training Center at
Yes,
Titusville?
at Pitt Titusville. Yes, absolutely. So we'll have dentists there that are completing their residency. There will also be dental hygienists doing training and dental assistants
Oh, that's
through
great.
Pitt Titusville. Yes.
Wonderful.
So very exciting, and it's really going to open a lot of appointments and just services for that need. It's definitely a need in the area for dentists.
Well, I think if anybody were to call a dentist right now just for a cleaning, a lot of them are like a year out.
Yes, it
Instead
is.
of that, that 6 months, and we can get into that conversation about kids and what they go through
Right.
and how that can be if they're having issues with their mouth, they're not learning in school, and there's all sorts of things that go with that. But
Yes.
yeah, that's great that this program's coming, and
Yeah, we're very excited for it, and it's definitely going to fill a need in the community. And our hope is that if these folks are doing their training here, they're going to like it here and want to stay, and that will obviously build some services up in the area.
that's great. Real quick, dermatology, audiology, additional ENT services.
Yes, so we are going to be adding dermatology. That is, I believe, happening in about 6 months. So finishing up with getting those services completed and getting them brought here. So it will be a little while, but it's definitely a need. It's come up in a lot of different conversations that dermatology needs to be added as a service. So we're really happy to bring that on board. Audiology also, that will be coming a little bit sooner, and an additional ENT. So definitely broadening those services, which is really great for everyone in the community to have those close to home.
Yeah, I've got some allergy issues or some
Yeah,
other things
it's a good
going
time
on.
for that, right?
Yeah. Dr. Rogers, what's that like for you, knowing that really, for the most part, you can take a patient in, and Titusville Area Hospital has services available for aftercare, like the physical therapy side of things, to know that there's a complete roadmap for a lot of your patients?
Yeah, we had some issues with inconsistent care. You do this, then they have to go there or elsewhere. And now we have a more centralized, more coordinated team approach. So the approach in surgery is there's no I in team. And now in care, there's no I in care. We even have added wound to the requiem of offerings. And so we're now able to handle other surgical issues from other services at the hospital. So patients are now able to come to Titusville Hospital and receive an opportunity to have diverse care in a centralized location instead of having to travel to Meadville or Erie or Pittsburgh. It is better. There's no way around that. It is better for the patient. It builds a better relationship. It builds a better confidence in the facility and the hospital and the city. And ultimately, it's going to improve the quality of care the patients get.
Yeah, if
It
anybody
takes
has
work, but it's getting there.
Well, if you have to, get in the car and you don't feel great and drive, a couple hours someplace, that can mentally be challenging. What would people be surprised in terms of your practice that you're able to handle in terms of when you say general surgery?
We can handle endoscopic evaluations, colonoscopy, EGDs. We can handle biopsies, major surgeries, minor surgeries. Certain things we don't have vascular, so that has to be sent to Meadville for vascular studies, etc. But most things that one would consider appendix, gallbladder, bowel resections, bowel obstructions, hernias, thyroids, ear tubes, tonsils, adenoids, sinus, allergies, skin issues can be handled at Titusville Hospital. The primary care physicians are aware that, they understand, refer to us. If it can't be handled here, we'll make the appropriate referral to the appropriate specialist. But as soon as we're able to get everything in this area, that will no longer be a need to refer. Dermatology, the wait is, well, a baby is faster.
Oh, wow.
Yeah. If you think waiting for a dental cleaning takes long, try to get a dermatology appointment. We do cancer screening, colon cancer screening, breast cancer screening. Getting a genetic analysis requires someone to have transportation. There's none in town. So we're working on filling these gaps. It takes time and resources. It's not an overnight thing. But the intent is to get people to come with a similar attitude to me. Come here with the intent to stay and work and become part of the community. So we're working on that.
Well, thank you. Thank you for your time. Thanks for coming in. Kelly, good to see you.
Thank you.
That's good to see you.
Congrats on the 125th anniversary presentation. That was very well done.
Absolutely. Thank you. Thanks for saying that.
All right, take care.
Thank you, Luke.